In today's World Insight, 3 years after the WHO declared the COVID outbreak a pandemic, how's the international community doing against a lingering public health menace? What has China done for its part in saving most of its population from the worst of the outbreak? And how far has vaccine and treatment research gone in protecting people from deadly variants?
Hello and welcome to World Insight with me, Tian Wei. In the past 3 years, China has been working with the international community against the worst of COVID-19. Amid the pandemic, China has been proactively involved in information and resource sharing as a responsible global player. In the year 2020, China joined the COVAX initiative, which helped distribute vaccines to vulnerable countries. So today we are going to comb through some of the key moments over the past 3 years and try to figure out the most important takeaways of our collective experiences. Helping us to do that, Dr. Alice King-Kyang Tan, internist at Ms. Medi Women's Hospital, and John Tsai, chairman of the China Healthcare Innovation Platform Academy. But first, when the unknown pneumonia started to spread in China formally informed the WHO and relevant countries on the latest situation, which laid a foundation for global scientific research and vaccine development. On this earlier, I interviewed Dr. Gao Fu, then director of the China Center for Disease Control and Prevention. How much more do we know about it since January?
What I can see from this is the 7th coronavirus infecting human beings. 7th. We already have 6 we know is infected human beings, but none of them really behave like this. This is really a special one.
The sequencing suggesting about 80%, if I remember right, compared to what we knew earlier about SARS, for example, from bats. Now, do we have further studies of that? Do we have any latest information regarding it?
You know, when you are talking about 80%, that's the average. So this is a coronavirus. Coronavirus is a single-stranded RNA virus. When you say single-stranded, that means the whole genome started 0 to 30,000. It's a linear, you call it linear sequence there. But those linear fragments, different kind of functional fragments, can be derived from different viruses. We call it recombination.
I see.
So for this virus, you can see some area, some fragments, they can 98% identical to SARS, but some fragments, some area, like receptor binding site, receptor binding fragments, we call the S, it's only less than 70% with SARS. So average, 80%. So this kind of virus is known for its recombination, i.e. you got one fragment from one precursor, the other fragments from the other species.
That's right.
So it's very hard, very difficult, sometimes for you. This is why we are talking about get the whole genome sequencing to compare where the virus.
From the very beginning, Dr. Tan, we were in contact. So tell me about your thoughts on how Chinese scientists were able to work with their counterparts from all over the world to understand what is going on at that moment.
Right. At the very beginning, of course, it was essential that the Chinese scientists noticed what was going on epidemiologically in terms of a new case of pneumonia that didn't have a known cause. And they did the evaluation in terms of what could be going on. And then they raised the alert. And without that early alert, the pandemic could have played out in a even worse fashion than what eventually did happen. And so I think the very beginning stages of reporting the genetic code of this new virus was essential, absolutely essential. And it points to what will be important going forward in terms of global surveillance and having surveillance capabilities, not just in developed countries, but in every corner of the world, in places that may not have laboratory facilities yet. It is up to us to get the world ready. And so from the very beginning, I think China established a model in terms of what needs to happen with surveillance and alerts.
Dr. Tsai, of course, the Chinese scientists were working extremely hard in Wuhan and beyond. Many of them gathered in Wuhan, tried to figure out what is going on. I'm sure you, as someone based in China, have fresh memories of those moments.
Yes, that's also, it's already 3 years ago, but that's everything so clear to me, because that's a really historical event in China, in the human history, I believe. In our generation memory, we have never been such kind of a really kind of a shock. So I'm thinking at that time, Chinese government really mobilized the resource, whole society's resource, including the medical care staffs, including even the local organization, including the companies, like a school. So at that time, everybody really mobilized to as the same thing, fighting with the same goal. So that's a really shocking the first 2 months, where we were able to quickly to get things as some kind of control without spreading to the other part of the China or even part of the whole world. So that's a very important first few months.
Right. Of course, lockdown later, the practice of that has been used in different occasions. Without further commenting on that, about later moments, but the lockdown of Wuhan, Dr. Tan, was a extremely challenging decision, but in retrospect, a right decision to make.
We understood this was an infectious disease. We needed a cordon sanitaire, as is called. In other words, a belt or a protective wall so that we can prevent spread. And so just based on the precautionary principle and the fact that this is human-to-human transmission, that's why the cordon sanitaire technique was used in terms of a public health measure. This is a time for reflection. As you said, it's been 3 years, the pandemic is winding down. It's a time of reflection and a time for preparation and trying to figure out what worked, what didn't work, and how can we prepare. And it's not a question of if or whether, it's a question of when and will we be prepared for the next pandemic, the next emerging pathogen. And so it's very good to have this opportunity to think and trying to review what has happened so far.
So I really wonder, Dr. Tan, you yourself a medical worker, the role that medical workers and scientists could play and have been playing over the past 3 years.
In the very beginning, I also remember just how terrified we all felt about what was going on. The uncertainty was very frightening for everyone, even doctors. And here in Korea, we had fresh memories of MERS outbreak, which is another coronavirus that happened in 2015. And I was at ground zero in terms of the MERS outbreak in 2015. And I remembered just what kind of medical personnel and effort was needed to keep our patients alive, even previously young, healthy patients who had MERS were in the ICU fighting for their lives. And so in terms of mobilizing healthcare workers and scientists to try to get a vaccine developed, to try to come up with best protocols for keeping our patients alive. The scientists in the labs who are trying to figure out, the secrets of how this new virus works. How can we come up with therapeutics? It was a gargantuan effort by the scientific community throughout the world, healthcare workers on the field, in the hospitals, in the front lines, not just doctors, but nurses and everyone who really gave it their all to keep every single person alive. Of course, we lost so many lives.
Once a city at the center of COVID outbreak in China is Wuhan. Wuhan showed great resilience in the battling infections. Dr. Du Bin, who's the director of the medical ICU from Peking Union Medical College Hospital, was one of the top epidemiologists dispatched to the city to curb the coronavirus then. He talked about his experience to me in Wuhan in an interview then. Professor Du, I mean, now you're only, if I look at the watch, you're setting off 2 o'clock leaving Wuhan. Have you take a good look at the city? I mean, what is it like for you, Professor Du, after all of these days and all of these days with life and death on the verge?
The past 3 months or 100 days is the longest day. It's the longest duration I've been away from Beijing, where I worked. I was born and lived and worked. So it's a strange feeling, to tell the truth. Whenever you know this is a time for me to leave, I still remember the afternoon on January the 18th when I first came here. I mean, to cope with the outbreak, and which is a cloudy afternoon. But right now is, it's clear, it's sunny, and it's warm. We know that the city, there are a lot of changes in the city after the previous 3 months. I mean, at different levels. Mm-hmm. The city management, administration, the hospital, the local healthcare authorities, the hospital administration, and even the healthcare workers, as well as the general public. I think this outbreak, which is already at the end of it, will have a great impact on the human behaviors, on the living habits of the local people. I do wish, and more importantly, I think I love the city, and I do hope to I mean, in the future, and I'm pretty sure of it, I will have the opportunity to visit the city again, to visit the hospital. I've been working here for the past 3 months, like Jintan Hospital, like the pulmonary hospitals, like the Zhongfa Sino-French New City Hospital. Yeah, I would love to come back, to have conversations, to meet with the healthcare workers there, and even some of the patients. Yeah, to see what is going on with them. It will be a nice memory.
Mr. Cai, of course, the victory of Wuhan after several months, especially from the support of the medical staff, has been very much, shall I say, praised and well remembered, dearly remembered by everyone here in China, including many of our international friends who cheered for the spirit of the medical workers and scientists as well.
I still remember at that time, we see the almost major big city like Beijing, Shanghai, we're sending medical staff to the Wuhan. Also, all the major hospital in the Shanghai, they all send out their teams to there. So people really moved. We also said that's the inverse direction movement for the medical staff, because for regular people, we just try to avoid away from the Wuhan, the center. But however, medical staff, they just go to the most dangerous place. I talked with one of the medical doctor in Wuhan. He also said during that 2 month period, all the medical staff, they are working on the frontier. They very moved by they get the warmly respect and welcome supporting from the regular people. He mentioned there are one midnight, he driving from home to the hospital. Maybe he drove a little bit speeding, then a policeman stopped him, then saw him wear a white the medical
doctors.
doctors closed. They said,
Yeah.
okay, they said, you just go, let him go. We really understand what you are doing. So all the medical staff in the frontier, they are very moved by
Right.
the supporting, by the respect, by the ordinary people. Also,
Right.
people really very respect to medical staff also.
As Dr. Tan said earlier, it has geared up all efforts from all over the world. We see scientists working around the clock in their own labs around the world in order to come up with the best remedy. And they did. And there are, seem to be different versions. And the world was gathering together, trying to establish platforms so that vaccines can be shared, not only for those who have it, but also to those who do not have it. China has been sharing medical resources with the international community against COVID-19, especially COVID vaccines. This international cooperation helped broaden access to vaccine doses, especially to the developing and the emerging economies. Uruguay is one of those countries that received the Chinese vaccines. I spoke to the Uruguay president earlier to talk about the cooperation between his country and China in containing COVID.
You know that last September, I was sitting just here and I made a phone call to Xi Jinping, President Xi Jinping, and he promised to distribute Chinese vaccines as a global public good. That was a very nice surprise. And he told us it will be available to people in every country besides China. So that was a very good message, straightforward, given by President Xi Jinping. We are very confident that China will supply more vaccines to Uruguay and other Latin American countries. They've already done it in a good quantity, in a very good time. So these bilateral and multilateral mechanisms are working with China, and we are very grateful. We are very grateful for that, and we are ready to upgrade our bilateral cooperation in the area of health. I would consider it very firmly to a new stage. This is done in the context of a strategic partnership, which has become increasingly comprehensive for us. We are living in a good time of our relation with China. My representatives stressed the importance that my government is giving to the Sino-Uruguayan health cooperation, and in particular, conveyed our urgent need to continue receiving the vaccines from China. You know that cooperation between Uruguay and China in the area of COVID-19 vaccines have been tremendously beneficial. I can tell you that honestly, that we are very grateful once again and happy of this cooperation we are having together.
Dr. Tan, I remember the platform that the UN together with others tried to establish, and it geared up a lot of support from different countries. China and many others volunteered to offer and contribute.
Right, absolutely. So all the scientists in their own laboratories, different countries around the world, in the UK, the US, China, Russia, we all worked so hard to get it was a race, right? To get a vaccine against this virus. In the US, they came up with a new platform, the mRNA vaccine platform. And then in China, we had the virus vector vaccine platform. We have now protein subunits. And so I think one of the great legacies of this pandemic, if we could say there's a silver lining, is the development of this infrastructure for research, so that when we have a new pathogen that has emerged on the stage, we can replicate and also accelerate what happened during COVID-19, so that we can have even better vaccines even faster.
Dr. Tsai, your thoughts?
Yeah, I'm thinking during, especially for China, I'm thinking the case of China, because of the early time in the Wuhan, the whole Chinese societies were able to get the virus, get some controls. So we winning almost afterwards, winning almost for 2 years, relatively stable and peaceful time. So we are able to, using this time frame, to really quickly speed up development of the new vaccine and antivirus drugs. I'm thinking also the economy in China at that time developed relatively much better well compared to the most other country in the world. I really appreciate during that peaceful, relatively peaceful, I would say, for the 2-year window times. So we did a lot of work during that 2 years.
China has taken dynamic control measures to cope with a rapidly evolving pandemic. COVID management has officially downgraded from Class A to Class B early this year, which eased the mobility while also keeping cases low. On efforts to better prepare for global health emergencies, I spoke to Mark Zussman, who is the CEO of Bill and Melinda Gates Foundation, and WHO spokesperson, Dr. Margaret Harris. Here's our conversations. The latest statement made by the World Health Organization about COVID-19 remains an emergency. However, we are seeing countries are making their different approaches to this global health emergency. What does that mean?
So the decision that was made, or the advice that was given to us by this independent emergency committee, was for the world. It's global advice, and it says this is where the global situation is, and the global situation does remain a public health emergency of international concern. But we do recognize that different countries are at different stages, or have different situations in their own communities. So no country will be exactly at the same point. But this was a characterization of where we are as the world. The numbers coming out of China suggest that now the surge is passing. That's very good news, especially for the Chinese people, so that they can at least enjoy the time together during the Spring Festival. But it doesn't mean that you say it's over. It means that you still must be vigilant. You still must be watching what happens next. This is an unstable virus. It keeps on tricking us. So we all have to really remain vigilant.
If you look at the COVID, it's not gone yet, even though it become an epidemic. However, we are likely to see more subvariant. Nobody knows where it's going. So what about the assessment from the foundation about how much resources to put into related research and development to support developing and emerging economies particularly?
Yes, so we certainly need that on pandemic preparedness generally, and so forth, both to continue dealing with the COVID crisis, which is still with us, but to make sure the world is better prepared for what will inevitably be another global pandemic. We do need a larger global effort. That the G20 actually recommended, with China's support, a support of $10 billion a year globally that could include some support to the World Health Organization, that could include support to monitoring and mapping diseases around the world. Unfortunately, the world has not been able to raise those resources to date. So even in the midst of all of this, and we know how much damage COVID has cost, currently there's been a contribution. There is a new fund that's been set up at the World Bank, but currently it has $1.6 billion. We've contributed to it. Many other governments have. The G20 supports it, but we need to make that 10 times bigger.
Dr. Tsai, your thoughts on the timing and also on the results we have already seen so far in retrospect?
Yeah, okay. If let me retrospectively to thinking back about our experience and lesson, what we could learn, I'm thinking it's very tough. It's a new challenge nobody have ever faced before. So for such a huge country, 1.4 billion population, or for China, the variation across different areas just so huge. So how to deal with this consistently across such kind of vast population land, it's very big challenge for China. So also the virus itself, it's changing from the beginning area, very dangerous, very point dangerous virus to gradually degraduation become less poisoning. So how to deal with this kind of new change population? Maybe we could learn some kind of lessons, how to change, adapt our policy, our way of deal with this virus. So we maybe had to control this, change the policy at time point, how to change that. If we look back, maybe we could be very smart. We may be thinking, maybe we could a little bit early to change the policy. Maybe that's the best point time. So but however, it's difficult to make that judgment at that moment.
Now, that certainly is also the key words for many governments around the world. Dr. Tan, your observation.
Right. So I've talked about this before, but the importance of communication, I think, is very key, and the role that the media has to play in terms of communicating a message, the role that social media plays as well. I think in the future, if we can harness the power of social media as an agent for positive change and make sure that we don't have the same kind of the viral disinformation that spreads, that would be helpful. And when we talk about, even within China, there's such diversity, I think every country needs to be much more inclusive in terms of planning for how to reach diverse people of all socioeconomic classes, all levels of education, all walks of life. How do we reach them with the right message and the communication so that next time everyone, all the people know what to do and actually follow public health advice? Because even if you have a great vaccine, if the people are not going to get the vaccine, accept the vaccine, it is useless. And right now, it's very important that when we talk about planning for the next pandemic, we talk about inclusion, not just within small communities locally or within nations, but on a global scale. We need to include all the members of low-income countries, low middle-income countries from the beginning in terms of how to plan for the next pandemic and what is going to be their role. How do we, do we listen to their opinions and what they need? And they have different needs than we do. And we need to listen and make sure that we include them in the discussion from the beginning.
Thank you so much, Dr. Kim Kyung-tan and Dr. John Tsai, for helping us better understand what is the takeaways from the past 3 years. Appreciate it. And that's all the time we have for today. If you'd like to know more, search World Insight. Check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei on behalf of my team. Thanks for being with us. Bye for now.